anterior compartment of forearm. Let's explore the anterior compartment of the forearm, its muscles, nerve supply, and key actions in simple terms. Forearm extends below the elbow and the wrist joint. Radius and ulna form its skeleton. These two bones articulate at both their ends to form superior and inferior radio-ulnar joints. Their shafts are kept at optimal distance by the interosseous membrane. Forearm is enveloped by deep fascia, also called as the Antebrachial Fascia. Deep fascia sends intermuscular septa and divides the forearm into anterior and posterior compartments. At the wrist, deep fascia is thickened to form flexor and extensor retiniculum. Anterior compartment muscles are well developed than posterior compartment muscles because they act against gravity. Hence, flexor muscles are called anti-gravity muscles, surface landmark, superiorly medial and lateral epicondyle of humerus, an inferiorly styloid process of the radius and ulna. Cutaneous innervation, skin over anterior compartment, is supplied by medial cutaneous nerve of forearm and lateral cutaneous nerve of forearm. Contents: superficial group of flexor muscles. And these are Pronator teres, humeral head, originates from medial epicondyle of the humerus, and ulnar head, from the medial border of coronoid process of the ulna. Insertion takes place into middle of lateral surface of radius. Action. This muscle is chief pronator supplied by the median nerve. Flexor Carpi ulnaris originates from common flexor origin, inserts into pisiform hook of Hamadeh, and fifth metacarpal bone. Action. It causes flexion and ulnar deviation at wrist, and is supplied by ulnar nerve. Flexor Carpi radialis. Origin takes place from common flexor origin. Insertion takes place at bases of second and third metacarpal. Action causes flexion at wrist and radial deviation of hand and is supplied by the median nerve. Palmaris longus originates from medial epicondyle of humerus. Insertion takes place at palmar aponeurosis and blends with flexor retiniculum. Action, it's a weak flexor of wrist and tenses the skin of the palm and is supplied by the median nerve. Flexor digitorum, superficialis, origin, muscle arises from two heads. Humero-ulnar head arises from the medial epicondyle and medial margin of coronoid process of ulna. Radial head arises from full length of anterior oblique line of the radius. Above the level of flexor retiniculum, muscle belly forms, 4 tendons, which goes for medial forefingers. Tendons are placed in superficial and deep strata. Superficial strata consists of tendons for middle and ring finger, and deep strata for index and little finger. Insertion. 4 tendons passes through the carpal tunnel and enters the palm. At the level of base of proximal phalanx, each tendon splits into 2 slips, and slips get inserted to the sides of the middle phalanx of the all 4 fingers. Action. It flexes proximal interphalangeal joint, the metacarpophalangeal joint, and the muscle is finally supplied by the median nerve. That's the anterior forearm compartment. Like, subscribe, and stay tuned for more easy medical videos.